Hello, and welcome to It's All About Your Health, Straight Talk with Dr. Nancy. My name is Nancy Greer-Williams, and I am a health researcher for the University of Arkansas for Medical Sciences.
Well, cancer is a big word. It's a scary word. And a lot of women or men, when they hear the word, they think of death. When you think about cancer, cancer is a cell that needs your body to survive. And so what you have to do is, one, make sure you don't get it through prevention. If you do get it, make sure it's early so that you can get the best treatment and get the best outcomes for your treatment. First of all, we say to tell people to know your risk. So what are the risks for getting breast cancer? The first is being a woman. The second is getting older. Then you need to look into your family history. Is there women in your family who got breast cancer? Are there men in your family that got breast cancer? Do you have women who had breast and ovarian cancer? Are you at risk because you have a gene? If all those things are zero, you're still at risk, because I said two things that will assure that you get it is that you're a woman, and as you get older, your risk increases. Well, studies have shown that exercise and diet are very important in preventing breast cancer. But if you can't prevent it, the next best step is early detection. 80% of women who find a lump, who come in to see me, find their own lump. So knowing the changes in your body. Now, I'm not saying that you have to examine your breasts every day. What I'm saying is know that if something changed, that you're aware of it and you get that looked at. The second step is when you turn 40, you should get your mammogram. We recommend first screening mammogram at age 40. And studies have shown that it benefits women from age 40 to 49, whether they get it every year or every 2 years. Beginning at 50, the studies clearly show that you should get a mammogram every year. It varies. Typically, it can range anywhere from $200 to $275, but most insurance cover breast cancer screening with mammography beginning at age 40. Now, in the state of Arkansas, we are very lucky because women that are poor can qualify for the breast care program that will pay for screening mammography beginning at age 40. What you typically have to do is go in to see your primary care doctor, and if you don't have a primary care doctor to get onto the breast care program, then you can call the local health unit and they can direct you in that area. So if a woman feels a lump in their breast, I recommend they go in to have this checked out by their doctor. What that typically entails is that the doctor will do a breast examination where they'll check the breast. If they are under 40 or over 40, most likely they will do an ultrasound of that breast to see whether this is a solid mass or a fluid-filled mass. If they think it's suspicious or that it may be a cancer, they'll either recommend them to get a mammogram, or they will recommend that they see a specialist that takes care of women who they're concerned about breast cancer. Both men and women are at risk for breast cancer, most commonly in women. It affects men about 1%, so 99% of the breast cancers that we find are in women. But as I alluded to earlier, it's important to know your family history, because if there was another man in your family that had breast cancer, you're at an increased risk to possibly have breast cancer. So we have special doctors that can talk to you about your risk. That's called a geneticist or a genetic counselor or a specialist in genetics that can look at your family tree and let you know whether you're at risk. So it's important that you talk to your doctor or talk to a friend about your history so that we can better service you. No one should have to die from breast cancer. Breast cancer, we have some of the best treatment for breast cancer. We have done so much research in breast cancer. We have new drugs that treat breast cancers, new surgeries where you can save your breast. So don't be afraid to get help, and don't be afraid to have perfect breast health. If you do get a lump in your breast, or if you are diagnosed with breast cancer, we have advanced so much in the treatment of breast cancer. So today, versus 30 years ago, most women do not have to have a mastectomy unless they make that choice. A mastectomy is removal of the breast. Today we can save the breast. We can do what we call lumpectomies, where we take the tumor out of the breast and save the breast. Because when you're being treated for breast cancer, there's 3 things I'd like for you to remember. We have to get rid of the breast cancer, we have to make sure it does not spread, and we have to make sure it does not come back. And we have all the advances and technology to do that. So how do we get rid of the breast cancer? We either take the tumor out of the breast or we remove the breast. You may or may not decide to have a new breast made. But if you don't get one made, we have options for that as well. You can wear a nice prosthesis. It's just like if someone had to have a leg removed, they would wear a prosthetic leg. It's the same for the breast. So you don't have to feel like you're bare-chested. So there are so many options. We also can give you chemo to prevent cells from spreading out through your body, and radiation if needed. Sometimes you don't have to have all of those treatments. So it's best, if you get the diagnosis of breast cancer, that you see an expert that can help you with that decision choice.
Thanks for watching. Our goal for this program is to give you good information that you can trust on health topics that you can use for you and your family to live a long, healthy life. If there is something in this message you want to know more about and you live in the state of Arkansas, take a moment to talk with one of our health experts at your local area health education center.